Hi, I'm Bob Shin. I'm a neurologist and neuroophthalmologist with a focus on caring for people living with multiple sclerosis. When I was in medical school, actually, MS wasn't a treatable condition. So I actually learned about multiple sclerosis as this immune system condition that caused demyelination of the brain and spinal cord. And kind of the lecture sort of wrapped up and there really wasn't much that could be done about it. It wasn't until I was in my training that the first treatment options for multiple sclerosis were developed. And some of you may remember those days of the ABCs of therapy. And so there were just a handful, not even a handful of options that we would sometimes discuss. I've been fortunate to watch and to, in some small way, maybe participate in some of the research that led to the development of additional treatment options, including pills for MS, including monoclonal antibodies or biological therapies for MS. And one thing that's been great about watching this explosion in our MS treatment options is beginning to offer, I think, more hope to individuals who are newly diagnosed with MS. But one of the challenges of this, of course, is how do we explain the pros and cons of the different treatments? How do we navigate when there's so many options, which one is going to be right for an individual? So, as I think we're going to discuss, there's a need to change our model in terms of how we have our conversations with people in the office. Well, some of the key factors in developing a personalized treatment plan are to recognize that everybody living with MS is having a different experience. Everyone has different concerns, different questions, different goals. So I think the main thing that I have to think about is make sure that I am listening and understanding what the goals are from the person living with MS from their point of view. So this is going to require a lot of getting to know each other. Certainly, I think of my role as almost a counselor, trying to provide information, but also try to put that into context, again, based on the individual's preferences and concerns. Well, involving not just the person living with MS, but the other members of their family or maybe their friends is extremely important. So generally, I would say the more people who can be a part of this conversation, the better. So actually, studies have shown that if somebody comes to see a doctor and is accompanied by a friend or family member, not only can more information be covered, but there's actually better retention of how the conversation went. So I think involving not just the person living with MS, but really any of their loved ones or allies is extremely important. And that really gets into this conversation that I was alluding to, that when we're sitting down and having a discussion about how to manage something serious like multiple sclerosis, it's not just valuable to get input from the person living with MS, but to get the perspective of the people who know that person best, again, their family and friends. So often there are conversations that will spring around, let's say, initially symptoms and recovery, and certainly that's very important. And then there can be discussions about things like treatment options. How are we going to manage the multiple sclerosis? How are we going to keep that under control? But I found that actually often it's other people in the room who may say, hey, wait a minute, what about this? Or hey, let's not forget about that. And those could be conversation about things like reproduction, plans for the future. For instance, perhaps somebody is accompanied by their spouse and might bring up the fact that they were thinking about having children in the near future. And that's going to certainly inform our conversation. Maybe it's a parent who wanted to bring up something that maybe they remember that, hey, don't you remember 5 years ago, 10 years ago, there was that time when you went to go see the doctor. So really getting all of those points of view and trying to bring them all into focus in addressing the person living with MS is really a part of that conversation. There are occasionally obstacles to having a really robust conversation. One is occasionally I'll encounter someone who will say, I just don't want to think about this. Why don't you just tell me what the best treatment is for me? Sort of that old kind of model where maybe the healthcare provider was just sort of paternalistic and just dictating what was going to happen. So in that case, I'm really going to try to engage that individual and have them recognize that this is shared decision making, that your input is as important as my input, and we're going to work together to come up with the best possible option for you. So again, that's not super common, but I do still occasionally get someone who has this other model of just thinking that, it's my job to just provide some sort of answer. And again, so they're just really trying to engage that individual and make sure they're a part of the decision is very important. Another obstacle that sometimes occurs is difficulty trying to get the right balance. For instance, if we're having a discussion about risks versus benefits. And I think this is really just human nature. And certainly someone in my office with a diagnosis of multiple sclerosis already is thinking, well, I just must be very unlucky. So if I'm unlucky and I have this diagnosis of MS, I'll probably be unlucky and have some other serious side effect occur to me. But in our conversations, I really try to make sure that although it's necessary for me to inform people about potential risks or safety concerns with any treatment that we're discussing, I do think I need to put them into some sort of context and make sure that they have a balanced understanding of how risks compare to the benefits. So for example, although it's my duty to share any even rare and unlikely event, I have to share that that's a possibility. I try to explain that, well, when we talk about the potential risks of starting a therapy, no matter how mild or how rare, I want to contrast that with what is the risk of not treating multiple sclerosis. And so again, trying to make sure that people don't focus only on the negative, but understand why using a highly effective therapy is critical, especially early on in the disease course. Again, getting that balance right is a challenge, but again, something that shared decision-making helps us navigate. Well, I'm just going to make a general statement, which is that, in my opinion, people don't tend to stick with medications that they're not comfortable with conceptually. So for instance, if I were to simply dictate and say, you have to take this medicine, without really allowing them to understand the, again, potential risks and benefits and the reason why we're using it, it seems as though people often do have trouble either tolerating the medication or just sticking with it. It just seems to be human nature that when you're not really invested, if you don't really have buy-in with the strategy, sticking with it tends to be more difficult. On the other side, I would say that when we've had the chance to have this conversation, when we've been able to talk through why we think this treatment is valuable, talk through any potential risks and concerns, how we're going to manage them, how I'm going to be vigilant for them, and make sure that all of your questions are answered. Make sure that before we even sign that prescription, that both of us are 100% on board. That's a recipe, I would say, for success. And we're very fortunate in the MS space to have so many now highly effective therapies that thankfully are generally safe and well tolerated. The key really is to make sure that there's a full understanding of the value of those treatments, getting that buy-in at the beginning. And in my opinion, that's what tends to ensure that people are going to be able to stick with that strategy. I guess it's hard to narrow it down to just one. I would say in general, this model, which is a relatively new model of having shared decision-making, of having this back and forth communication and these conversations between the two sides, the person living with MS and the healthcare provider, has paid dividends, and that I think we're much more successful in the treatment of MS in general. And we've been able to allow people to have productive and healthy lives. I don't want to over exaggerate it, but people can live with MS and sometimes almost forget that they have that condition. But to think of one particular example, and I alluded to this a little bit earlier, there was a situation where a young woman newly diagnosed with MS, and this is a lot of my practice, shared that she and her husband had actually been planning to have children in the near future. And she, of course, was concerned about how this new diagnosis and all of these treatments we're discussing, how is that going to really play into it? And because she was willing to share that, and because we were able to have a very frank and honest conversation about it, we were able to design a treatment plan that allowed her to get some treatment across a certain time interval and ensure that we're controlling her MS as best we can and giving her that window of opportunity to work on having a baby. And I'm happy to report in this scenario that she was able to successfully get pregnant and have a super healthy baby. And we were able to keep her multiple sclerosis under control during that time interval and get her back on therapy after she had that child. So it was complicated, but really we would not have been able to navigate that situation if we had not been able to have this very honest conversation between the two of us. What I'd like people listening to this video to take away from it is really this idea that you are really part of the solution here. So multiple sclerosis is a serious condition. This is a serious diagnosis and it can be very frightening. I think that many people, if they'd been aware of multiple sclerosis, immediately their minds go to things like walkers and wheelchairs, and they think about disability and they ask themselves, what is my future going to be like? Am I going to be able to have a family? Am I going to be able to be productive in my job? I don't want people who are facing a new diagnosis of multiple sclerosis to face it with fear. I really want them to feel that this is something that is manageable. This is a condition that is now treatable with highly effective treatments. But in order to control this condition, we need to have a conversation. We need to be able to discuss the different potential treatment options. We need to be able to discuss potential risks, but also why these therapies are so helpful to individuals living with MS. We also need to be able to have a conversation about details about you as an individual. I mentioned things like, are you planning to have a family? But maybe it's important for me to know what your career goals are. Maybe it's important for me to know that you have a family history of this, that, or the other thing that you may be concerned may interact with multiple sclerosis. Maybe we're going to have a conversation about how even before the diagnosis of MS was made, there were other symptoms, things like fatigue and anxiety and depression and cognitive issues that may have been part of an MS prodrome. All of these things we can address and we can tackle and we can help people live their best lives, but only if we're able to have an open conversation between the person living with MS and the healthcare provider and really the whole healthcare team.